And it shouldn't have to be that way, because we have a number of effective methods of contraception such that people should not have to go to sterilization if they don't want to go to sterilization. Sterilization is perfectly fine. It's just that, again, not every couple wants to go to sterilization.
Because it's not reversible.
It is not reversible. Whereas a IUD, the implants, they're all reversible contraceptive methods, in addition to the pill and the hormonal methods that we have talked about.
Okay, Vanessa, you referred to some of the benefits accruing to women as a result of the healthcare reform legislation. Are there any others that we haven't touched upon yet?
Fran, I think it's important for everybody to recognize, one, that it's both men and women and children that are going to be insured who previously were uninsured because of this legislation. And in fact, people think that those that are uninsured are non-working folks. For the most part, those that are uninsured and who will now have insurance are really the working poor who either have no insurance or have inadequate insurance. And so what people will have through this legislation are a number of different things that are very important and much better than what we have seen in the past. One, pre-existing conditions will be covered. And there have been some situations where pregnancy has been considered a pre-existing condition. For example, you have a woman who's working at a job and she's covered by her insurance. She becomes pregnant, she leaves that job, she goes to another job, and the new insurer tries not to cover her for prenatal care. Totally ridiculous. Now, the other good part of this legislation is that young adults will be covered up to age 26 under their parents' insurance.
So that includes college students?
That includes college students. That definitely does. And you know, college policies tend to be very lacking in terms of benefits unless you're going to pay a tremendous amount of money. And it takes a while for most people to really get on their feet, whether they're in college or not, because we live in this increasing technological society, and it requires that you have advanced training, that you go to school. So this is really a break for young people that are trying to finish their education and also trying to enter the workforce. In addition, the practice had been among many insurance companies to charge women more for their benefits than charging men, and that is gone as a result of this healthcare reform legislation. So there are a tremendous number of benefits that will accrue to large populations of people in this country.
So we move from the adults to the college students. How about teens? To what extent will they benefit either their access to reproductive health care or reproductive health care education?
The bill also includes measures for medically accurate, comprehensive sex education, and also educational programs that have been shown to work in this country. And in general, as you know, Fran, the abstinence-only programs have been shown to not be successful. However, if you have abstinence along with medically accurate information about contraception and sex and sexuality, along with some of the programs that include job skills and educational components, those are the types of programs that have been shown to result in a delay in the starting of sex and increased tendency to use contraception when sex is begun.
We're celebrating a lot this year then, not only the 50th anniversary, but also the passage of the healthcare reform legislation. Are we going to see, we still are seeing a lot of abortions in this country. Are we going to see a decrease in abortion? What is Planned Parenthood, for instance, doing to lower the rate of abortions?
Well, you know, our focus at Planned Parenthood is prevention. And the way to see lower levels of abortion is to increase access to contraception, increase access to education, and to have a society that will be supportive of people's use of contraception and be supportive of all who are sexually active having access to contraceptive services. It's really all women that access abortion in this country, and it's estimated that by age 40, 1 in 3 women will have had an abortion in this country. It's really all women that need easy access to contraception, which in this country requires some form of insurance coverage unless you're paying out of pocket.
Now, is our abortion rate remarkably higher than other developed countries?
Indeed it is, Fran. It is much higher than in similarly developed countries. It is much higher than in countries where you do have universal health care. And again, health care reform is not really universal health care, but it gets us much closer to it than we ever have been in the past because more people will be covered. We're much higher than those countries that have comprehensive sex education, Sweden, the Netherlands, Canada. You know, it's really the same countries that are far more advanced than we are in the way that we deal with sex and sexuality and contraception. So to make a long story short, hopefully by the time we celebrate the 100th anniversary of the pill, perhaps we will be in a different situation from the standpoint of the number of unintended pregnancies that are occurring in this country, and in a different situation in terms of teen and adults access to contraception.
So you're talking about not just this year's 50th anniversary, but your dreams for the future, for what you would love to see Planned Parenthood be able to achieve in the next 50 years, say.
The ideal dream would be that there is such easy access to birth control in this country, such easy access to any reproductive health care service in this country, that it is covered such that Planned Parenthood doesn't have to really even exist, because we have achieved what our mission has said we should be achieving, and that is to ensure that men and women have the means to decide whether and when to childbear or become pregnant, or to make a pregnancy in the case of men. So in my mind, the ideal world would be one where there is no need for a nonprofit that has to be out there fighting each and every day just to try to ensure that men and women in this country have access to reliable health care services. So the prerequisite for all this would be there would have to be reliable health care services that are easy to access by all men, women, and teens in this country.
Vanessa, over the course of this evening, you have led me to be ever more optimistic for the health care of our friends and neighbors throughout Westchester and throughout America. And I thank you very much for your service to this country.
Thank you, Fran. I really enjoyed this.
And I want to thank our Westchester friends and neighbors for joining Vanessa Cullins of Planned Parenthood and Future Choices tonight. Good night.